According to the U.S. government's Agency for Healthcare Research and Quality, spinal fusion is one of the most common surgical operations, just behind knee and hip replacements. But another type of replacement procedure has increasingly been helping spine-related pain sufferers in ways they never dreamed possible. It's called total disc replacement, and it may just help you regain your active life. But how is total disc replacement becoming such an exciting alternative to spinal fusion? In a spinal fusion surgery, one of the main goals is to minimize motion in the affected area of the spine in order to keep the local nerves from being compressed or irritated. But what if instead of preventing the motion, you could reduce pain while enabling the natural range of motion of the spine as an alternative? That's how total disc replacement works. With total disc replacement, or TDR, the unhealthy disc is replaced with a device that maintains motion, enabling, bending, and twisting without overstressing the adjacent discs. But if it's possible to preserve the natural motion of the spine, why isn't total disc replacement always recommended for patients?
When we consider a patient for surgery, we first decide whether they're a candidate for a fusion. If they're a candidate for a fusion, then we decide if they're an appropriate candidate for a disc replacement. Not everybody is a candidate for disc replacement. We actually take into consideration patient's history, their anatomy, and many other criteria to make sure that disc replacement is a good fit for that patient specifically. If you actually present with severely degenerative disc disease, or if the spinal joints that connect the levels together are severely arthritic and a source of pain, total disc replacement may actually not be a good option for you, and you may be better served with a fusion. If, on the other hand, patient is maybe younger, earlier in their degenerative pathway, or if they have a single bad disc and the rest of the discs actually look pretty good, and you have a lot of active years left, then total disc replacement may be a great option for you.
And while total disc replacement has been gaining in popularity more recently, some devices have been implanted in hundreds of thousands of patients, with proven effectiveness through 30 years of clinical study. So, ask your doctor about total disc replacement.
Coming in and being seen is not an obligation to having anything done. It allows you to educate yourself on opportunities that might be available, including disc replacement, that could decrease your level of pain and increase your quality of life. I would welcome the opportunity to meet with you and review options that might be appropriate for you.